Hey guys, it's Tara from 44 on the Town, and today we are here at the Eberbach Plastic Surgery. Let's go meet the doctor, some of his great staff, and hear about all the great procedures they have to offer.
I'm Dr. Mark Eberbach, and I want to welcome you to my office to see what it is that I do in plastic surgery. I've been in practice here in Tampa Bay for about 27 years. Originally in Tampa, and then moved my practice out to Hudson, where it's a little bit more rural and comfortable. My practice offers the full spectrum of cosmetic plastic surgery. The most common procedures in the United States, and probably in the world now, are non-invasive procedures like neurolytics, like Botox, and soft tissue fillers like Juvederm, because they're relatively easy with almost no downtime. So those are the most common procedures that are done. But when it comes to surgical procedures, just like most plastic surgeons who are busy in the United States, breast augmentation is probably my #1 operation, followed by liposuction and body contouring, and then finally facelifting kinds of procedures. Here at Eberbach Plastic Surgery, I have my own operating suite in the back. It's a fully accredited surgery center. It is licensed by the state, and we go through yearly reviews and safety checks so that I have a center that has all the facilities and capabilities of any hospital-based outpatient surgery center.
So Leah, we are standing here in front of the 3D imaging machine that Dr. Eberbach offers his patient. Can you tell us a little bit about this specific machine and what are the kind of benefits that it offers your patients?
Yeah, definitely. I think this is definitely, the 3D imaging machine is something that really distinguishes us from some of our competition. When you come in for a breast augmentation consultation, we'll actually position you in front of this machine and take 3 different images of you so you can actually see yourself from like a 180-degree angle. And then, depending on what kind of implant you want, we can actually show you what it would look like in your body. So it'll actually do a virtual image of you with the implant that you choose, and so you can actually see different sizes for your body type and actually see what it really looks like inside of you.
So within a few minutes of coming in for your consultation, you can see on a computer screen what you could potentially look like depending on what size you want it to go to.
Definitely, yeah, that's definitely a big advantage here. And you can even see, you can see side, you can see front, you can see different angles, which a lot of people are really interested in as well.
Because cup sizes change for every place you go. You never know. You say you might want a C cup, I might want a D cup, but this actually really shows you the picture of what that cup size will look like on your body.
Right. It really depends on your body style, your weight, your height. It's hard if you did a 421cc implant, it would look completely different on you compared to somebody who is 5 foot. So this is something that you can really see what it will actually look like in you and your body type.
My consultation experience with Dr. Eberbach was very relaxing, which was one of the other reasons I chose him over one of the other doctors. I mean, he took the time to really sit down, figure out what I wanted, because I kind of had a really good idea since he was the 3rd doctor I'd met with what I was looking for. But with his imaging program, it was really easy to put it in a visual perspective of what I would actually look like and make it such an easier decision instead of feeling like, hey, here's some pictures of some random other people, which one do you want to look like? It was more personal based towards what I'm going to look like at the end.
We understand at Eberbach Plastic Surgery that you might be busy during your day, you might be working, you might be out of town on your phone, so we really try to cater to your needs. If you go on eberbach.com, and you're researching, you can actually live chat with one of our patient coordinators and ask them questions if you don't have time to get to a phone or if you're not allowed to use a phone. And they can actually set up the consultation from there and answer all your questions.
A lot of people ask me what happens with the breast augmentation, how it's performed, how long it takes, what the recovery might be, what incision is used. So those are fairly common questions, all of which I would answer carefully in a consultation. To answer that question a bit more specifically though, my average breast augmentation surgery takes me about 25 or 30 minutes. And I know that seems fairly quick, and I guess it is, but I've been doing this for many years and several thousand operations. My office staff knows exactly what to give to me to help me in the process, so it moves along very efficiently. The anesthesia staff I have is also extraordinarily well trained and knows how to do outpatient surgery, so patients go to sleep quickly and wake up feeling really very good, so it's only about an hour total for them to be asleep.
I had a breast augmentation. I did the high profile implant, and I had the best experience that I could have possibly imagined. I thought it was going to be scary. I thought I was going to be sore. I thought I was going to have so much more downtime. I had really researched a lot before I went with Dr. Eberbach. I had even seen a surgeon in California, in San Diego. I had gone here, St. Petersburg, and this by far, from the minute that I came in the door, was just so comfortable and just so at ease, and felt like I was like the only appointment that they had that day.
I want to thank you all for listening, and I want to welcome you all to come in for a free consultation if you're curious. Or you could visit my website, eberbach.com, and review before and after pictures. But really the best choice, in my opinion, is to come in and sit down and see some of these things for yourself. You can certainly decide not to proceed, and some patients don't, or they put it off a few years. But it's nice to have that opinion one-on-one so you know what you might be looking at.